What is a scratched eye? If you've ever suffered from a scratched eye, don't worry, you're not alone. The official medical term for a scratched eye is a corneal abrasion, but in simple terms it's a scratch on the clear front surface of your eye, otherwise known as the cornea. It's actually one of the most common eye injuries, and even though it can be painful, it's usually quite minor. It can happen for all kinds of reasons, from sports or DIY injuries to getting sand in your eye. What are the symptoms of a scratched eye? If you have a scratched eye, you'll almost certainly feel discomfort. You may feel like you have sand or grit in your eye. You might notice your eye seems a little red, and you may experience sensitivity to light. You could also experience teary, watering eyes, blurred vision, or pain when opening or closing your eye. If you experience any of these symptoms or changes to vision, it's important to get your eyes checked quickly to make sure there's no serious damage. What causes a scratched eye? Anything that makes contact with the surface of the eye can scratch it, causing injury. But common causes include airborne particles like dust or sand. Foreign objects like makeup brushes or objects that make contact with the eye during DIY, sports or playtime can all lead to scratched eyes. If you suffer from dry eyes, you may be at greater risk of corneal abrasion or damage. This is because your eyes aren't getting enough lubrication. Dry eyes can make your corneal surface much more fragile, and even something as simple as rubbing your eye can cause scratches. How long does a scratched eye take to heal? The majority of corneal abrasions will slowly self-heal over a number of days. However, a scratched eye may require eye drops or ointment. This is because surface damage makes the eye more susceptible to infection, and additional lubrication can help the healing process. If you notice any changes in your vision or are worried about a scratched eye, you should contact your optician for more advice. Can you wear contact lenses with a scratched eye? If you suspect you have a scratched eye, you should stop wearing your regular contact lenses until your eye has healed. This is because you're at increased risk of an infection developing underneath the contact lens. Contact lenses won't protect your eyes from corneal abrasions. In fact, worn or damaged contact lenses may increase the risk of scratching your eye. If you're undertaking an activity such as DIY, you should always wear the proper safety equipment. Should I use eye drops to treat a scratched eye? If you get something in your eye, the temptation is to rub it. Don't. This can make things worse. If you feel something in your eye, you can attempt to rinse it with a sterile saline eye wash or contact lens solution. Don't use tap water, as this can contain harmful bacteria that could cause an infection. Your optician may prescribe antibiotic eye drops to prevent an infection from developing. Regular over-the-counter eye drops may help ease the discomfort of a scratched eye, but they won't prevent an infection developing. That's why it's important to see an optician as soon as possible.